Hi everyone. Today we're going to talk about how dysfunctional the healthcare system is in the US. Next. Imagine a healthcare system where getting the care you need feels like navigating a maze with no exit. Welcome to the reality of millions of Americans trapped in a dysfunctional healthcare system. Next. The key points we will be talking about today are shortage of doctors, cost, life expectancy, and highly expensive healthcare systems, and how other countries work and are more effective. Next. The shortage of doctors in the U.S. is a significant and growing concern. According to the Association of American Medical Colleagues, AAMC, by the year 2034, we may not have enough doctors to meet the needs of our population. The AAMC predicts a shortage between 17,800 and 48,000 primary care physicians and between 21,000 and 77,100 non-primary care physicians. Next. The shortage of doctors in the U.S. is a complex issue with several significant reasons. One of the primary factors contributing to the shortage is the aging population. As people grow older, they tend to require more medical care, including treatment for chronic conditions and age-related illnesses. This increased demand for healthcare services strains the system, requiring more doctors to meet the growing needs of the population. Another key factor contributing to the shortage of doctors is physician burnout. Doctors often work long hours under high-pressure conditions, which can lead to physical and emotional exhaustion. Burnout can negatively impact the quality of care provided by doctors and may result in them reducing their working hours, retiring early, or leaving the profession altogether. Addressing physician burnout is crucial to ensuring that doctors are able to continue providing high-quality care to patients. Additionally, the limited number of available slots in the medical schools and residency programs is a significant challenge. Medical education is demanding and time-consuming, and the high cost of tuition can deter some individuals from pursuing a career in medicine. The shortage of medical school slots mean that fewer doctors are entering the workforce each year, worsening the shortage of doctors. Next. The shortage of doctors in the U.S. have serious consequences that impact patient and healthcare providers alike. Rural and underserved areas often have fewer healthcare providers, making it difficult for residents in these areas to access timely and quality healthcare service. This shortage can make it hard for people to see a doctor when they need to. Imagine if you were sick and needed to see a doctor, but you had to wait a long time. When doctors are too busy, they also might not be able to spend enough time with each patient. This can make it hard for them to give the best care. It is important for doctors to have enough time to listen to their patients, understand their needs, and provide the best treatment possible. Another significant consequence is increased wait times for appointments and procedures. As the demand for healthcare services exceeds the supply of doctors, patients have to wait longer to see healthcare providers or undergo necessary medical procedures. This can lead to delays in diagnosis and treatments, potentially worsening health outcomes for patients. Additionally, the shortage of doctors places a strain on existing healthcare providers and resources. Doctors and other healthcare professionals may be required to work longer hours and take on more patients, leading to increased stress and burnout. This can negatively affect the quality of care provided and may result in healthcare professionals leaving the profession or reducing their working hours. Furthermore, healthcare facilities may struggle to meet the needs of the patients, leading to overcrowding and resource shortages. Overall, the shortage of doctors have consequences that impact both patients and healthcare providers. Addressing this shortage is crucial to ensuring that everyone has access to timely and high-quality healthcare. To solve this problem, we need to make sure there are more doctors available to provide care. It is essential to implement strategies that increase the number of doctors entering the workforce. This could include expanding medical school and residency programs, providing incentives for doctors to practice in underserved areas, and implementing measures to reduce physician burnout. The shortage of doctors in the U.S. is a complex problem with far-reaching implications for the healthcare system. By understanding the cause of the shortage and implementing effective strategies to address them, we can ensure that everyone has access to the healthcare they need. Next.
Along with the healthcare problems that we have with our system, if you take a look on the bottom graph here, it shows the average the graph shows it paints a troubling picture that a child born in the US in 2021 could expect to live around 76 years, which is a decrease from nearly 79 years in 2019. This downturn is the most pronounced over a 2-year period since the 1920s. This highlights a severe shortcoming within our healthcare framework. And if you look at the graph above, it shows the life expectancy at birth and health spending per capita during 2019. This is according to the database from the World Health Organization, World Bank. And if you take a look, you'll see lots of countries towards the middle of the graph. And on the x-axis, you'll see the amount of spending for healthcare and the life expectancy on the vertical graph. On the very far right, you'll see that the United States is the highest spending country in the world, according to GDP per capita, for healthcare. And yet we have a very low life expectancy compared to many other countries around the world. Our nation outspends other developed countries on healthcare, yet we lag in vital health outcomes, including life expectancy, but the system is riddled with exorbitant costs, inequitable access, and a convoluted insurance landscape, resulting in a significant number of individuals being underinsured or uninsured. According to a Harvard study in July of 2021, healthcare was offered during World War II to attract men to join the military. Few people had private insurance then, but now just a single layoff can jeopardize anyone's access to healthcare. Access to healthcare is uneven. The current US healthcare system has a cruel tendency to delay or deny high quality care to those who are most in need of it, but can least afford its high costs. This contributes to lower life expectancy compared to other countries. This is something that's called health disparities. The additions to the addressed problems are how convoluted insurance policies can be in the article, Complexity in the U.S. Healthcare System is the Enemy of Access and Affordability, which was a survey study done by KFF, a nonprofit research organization. They found that in almost 6 in 10 people within their study reported a problem with their insurance from last year. The complex problems occurring affects access and ability, which makes it more difficult to quantify the coverage of our citizens. So the time has come to confront the reality that our healthcare system necessitates profound reform. It is a matter that transcends mere statistics. It is about the well-being of our communities, of our loved ones who suffer due to these systematic failures. We must champion a healthcare model that emphasizes preventative care, values every life equally, and guarantees comprehensive coverage regardless of one's financial standings or backgrounds.
Okay, I'm going to talk about costs of healthcare in the United States. The United States is the most expensive healthcare in the entire world, and they have bad quality healthcare for how much we have to pay. It's gone dramatically upwards in cost in the past few years, as you can see on this graph from the Peterson Foundation. It shows the national health expenditures in percentage of GDP, and every year it just gets higher and higher. When the year that COVID happened, it had a spike, and then it's gone a little bit down, but it's still higher than in past years. In 2022, healthcare expenditures per person in the US were $12,555. The US spent $4.5 trillion on healthcare. And so divided by everyone in the United States, that was 12,000 per person, which is over 4,000 or double more than all other high income nations. Next. So to break down the costs a little bit, there's a lot of different things that can contribute to the price of healthcare. Wasteful systems where doctors and hospitals waste products or waste resources, or they don't go to use and expire too fast. Rising drug costs, so it's one of the biggest problems that raises our healthcare prices. We have a lot of drugs and prescriptions that are being sold in a profit-driven way and for marketing, and they aren't actually sold at what they should cost. A lot of drugs have been coming out with generic brands or things that can lower the costs of healthcare, but it still is higher than other countries. Another thing that can raise is medical workers' salaries. They have to be paid, and so that can add a lot to how much we pay for our healthcare because we're providing their salaries. And then it can also just be profit-driven healthcare centers or other things that raise the price because they have to make money and earn a profit from it. Another thing, in the United States, the population of 65 and older is constantly rising, and in the past year it rose by 3%, and in 2025 is estimated to rise again by 3%. And people older than 65, normally you have more healthcare and have to spend more money, and so that also raises our costs, as well as new technology that they're developing for different medical programs and medical practices and things that can help us at hospitals. Another one is consolidation of hospitals. If one hospital runs out of money and they consolidate with another one, there's a lack of competitors, and so then they can raise their prices, which is just market-driven profit. Next. So the last thing I want to talk about is cost versus quality. So we're paying so much in the US for what quality? We're not getting any quality really out of what we're paying, while other countries and other places are paying a lot less. The US healthcare is rated overall worst out of all high income nations, which is pretty crazy. A lot of health measures that the US does poorly compared to other places is life expectancy, preventable hospital admissions, suicide, and maternal mortality rates. We have really bad numbers for all of these compared to other places. So it's just really surprising that in the United States we pay so much and still the numbers and statistics are so horrible. A higher cost of healthcare also leads to less people having access to the healthcare and the system that they need to get help. Most Americans say that the healthcare system fails them because it's so expensive and they can't afford it, or it causes bankruptcy. And there's so many reasons that the cost of healthcare is unfair, and we pay way more than we should for the quality of care that we're getting. So we need to improve the cost or lower the cost and improve the quality of our work here. Thank you. Next.
Okay. Yeah, as many of you are aware, the US healthcare system is often considered to be lacking in comparison to other countries. From rising costs and what some may call a corrupt healthcare system that not all benefit from, US citizens are overall dissatisfied with the system and its lack of benefits. This leads us to ask what could be done to improve our current system. And in order to better understand possible improvements, it's important to observe how other countries have built upon their principles of healthcare to create an efficient and cost-effective system that has a higher approval rate than the US. The US ranks last on access to care, efficiency, equity, and healthcare outcomes. Countries with top performing healthcare systems include Norway, the Netherlands, Australia, and Japan. Looking closer at these countries, a trend among their healthcare systems is that they have some form of national insurance program that covers majority cost of their healthcare for all the citizens. These insurance programs can cover anywhere from 70 to 100% of healthcare costs, which is a lot higher than the US, which is 30 to 40%. Their healthcare systems provide nearly universal access to medical care services and involve greater financing and regulatory roles for the federal government and less reliance on competition in healthcare matters. Data suggests that the US spends more on medical care as a fraction of GDP than other countries do. The United States ranks last overall, despite spending far more of its gross domestic product on healthcare. The US ranks last on access to care, efficiency, equity, outcomes, but second on measures of care processes. The most notable way that the US differs from other industrialized countries is the absence of the universal health insurance in healthcare. 5 other nations ensure the accessibility of care through universal health systems and through better ties between patients and their physicians. Next slide, please. So I'm just going to go into a little bit about how other countries do things. You'll see that these first 2 countries are obviously in Europe. So Europe has a pretty set way of doing things over there. Again, a lot of the countries have universal health coverage and healthcare for everybody. So Norway, for example, they have universal health coverage that's funded by taxes and payroll, which means that it's just publicly funded. There are patient fees and copays that are there, but they're really small and not that big. You'll hear me talk a little bit about Bismarck model, which basically is like mandatory health insurance for everybody. So the Netherlands has this. They make health insurance crucial for everybody, including students. So even if you're there for international school, they make you get mandatory health insurance. There are different options to choose what plans you want to do, kind of what works best for you, or you could choose the private health route, but same thing, there's just standardized coverage and pricing, so while there may be some costs, it's not a lot. Next. Just to continue that, Japan is also really good and has a really good healthcare program over there. They are also part of the Bismarck model, again, meaning that they have mandatory health insurance. They just have lower healthcare costs in general, but they really lean on preventative care. So starting early on, they live healthier lifestyles to kind of prevent having to use the healthcare that much. And they have a really high life expectancy over there as well, which means that something must be working. Australia, again, universal coverage, but they are really big into Medicare. So they also have something called a PBS system, which is pharmaceutical benefit scheme, which basically just means that they can get prescription drugs for a lot cheaper of a price, kind of in bulk, but every single person there is on Medicare. Next. So some things that the United States could implement, again, preventative care is a really big one. I think it's kind of known that the United States is an unhealthy country. So starting young and getting people to start being healthier and living healthier lifestyles at an earlier age would be amazing. Also, of course, leaning towards universal health care, which may be difficult, but obviously if other countries are doing it, then it probably could work here as well. And then last, the cost efficiency. As others have mentioned, the United States pays the most for their healthcare, but honestly gets not very good results for it. So those are some things I think that the United States could work on. In general, I just think that looking over at different countries and seeing how they do things and seeing how they implement different things and seeing that it works is something that the United States could just do in general, as our healthcare system needs some help and is not the best. So thank you so much for listening to our presentation, and we hope you enjoyed.